You are now listening to Protecting Your Nest with board-certified family medicine and obesity medicine specialist Dr. Tony Hampton. For more, visit drtonyhampton.com. Welcome to the Protecting Your Nest podcast. Have you ever wondered why some people suffer from mental illnesses while others don't? It's a complex question and one that many are still attempting to find answers for. But imagine if there was a way to heal from the many illnesses that affect the brain, not with a dependence only on drugs, but by incorporating lifestyle changes that include a carbohydrate-restricted diet. Would you be interested in learning more? Well, today's guest is here to provide some insights, which I am sure will help restore some hope for the millions of people who are suffering from mental illness and looking for a better way to heal. Today's guest is Dr. Georgia Ede. Dr. Ede is a Harvard-trained, board-certified psychiatrist who has a bachelor's degree from Carleton College in Minnesota. And after 5 years in general practice, she joined Harvard University Health Sciences from 2007 to 2013 and was the first psychiatrist there to offer nutrition consultation as an option to students, faculty, and staff with mental health concerns. From 2013 to 2018, she was the psychiatrist for Smith College in Northampton, Massachusetts, where she provided nutrition consultation as well as medication and psychotherapy services to the Smith students. Now, Dr. Ede devotes all of her time to nutritional psychiatry and directs her efforts on studying, writing, speaking about the strong scientific connection between food and brain health. And she also writes frequently for Psychology Today and has her own website at Diagnosis Diet. In 2018, she independently published a paper in the Journal of Evolution and Health. And with that intro, Dr. Ede, it is my pleasure to welcome you to Protecting Your Nest.
Thank you very much, Dr. Hampton. It's really a pleasure to meet you and to be able to talk with your listeners.
Absolutely. It's kind of funny when I thought about your name and I thought about a previous guest, and her name is the Black Carnivore. But she pronounces her name Ade, which I thought was interesting. You pronounces your name differently, so I thought that was kind of cool, and really enjoyed having her on board, particularly since you guys have similar dietary patterns. So it'd be interesting to talk about your diet and how you got to it. And I think we'll start our conversation actually about understanding a little bit about some of the challenges you face from a medical perspective and what kind of drove you to change your diet and how that diet has impacted how you're living today. So let's start our conversation with that.
Sure. So I think, like a lot of doctors that come around to these, very powerful nutrition interventions, we didn't learn about them, in medical school or residency. Most of us found our way to these ways of eating through our own, through trying to solve our own problems. And so that was the case for me. I'd run into some problems. I'd always been, healthy and exercised a lot and, ate what I was told to eat, high fiber, low cholesterol diet, lots of, white meat, chicken breast and salads and soy milk and Diet Coke and things like that, kind of the standard diet that women follow to try to keep their weight under control. I did always have weight problems growing up, even as when I was really young. So I really only thought of food as a way to manage my weight, which is really unfortunate because, it's so much more than that. So anyway, I was practicing traditional psychiatry, medications and psychotherapy for a number of years. And then in my sort of early 40s, I started to develop some health problems, some kind of perplexing things that stumped all my smart Harvard doctors. They didn't know what was wrong with me, had, a lot of pain and fatigue, a lot of IBS symptoms, migraines, things like that, and was really starting to interfere with my ability to work. And a lot of my patients had a lot of these same issues, and I was never able to help my my patients with these issues. So I thought, okay, now I'm in a pickle, because if I can't help them with these issues, how am I going to help myself? And I'm very sensitive to medicines. Didn't want to take medicines, and for all the different symptoms I was having, I would have had to take 6 or 7 different medicines anyway. So I just kind of started simple and kind of did some experiments with my diet, because one of the things I was struggling with was a lot of stomach pain, off and on. And so I thought, well, maybe it's something I'm eating. And so I just trial and error. I kept a food and symptom journal for a while, and just started changing my diet around until I gradually felt better and better and better by doing little experiments just at home. And what I ended up with after about 6 months was this diet that was completely upside down from what I was told to eat. Instead of being high in plants, it was low in plants. Instead of being low in fat, it was high in fat. It just it solved every problem that I was facing. I felt better than I'd ever felt before, and that was great. But I honestly thought, because of the way that I had been taught about nutrition, I honestly thought that diet was going to kill me. I thought this diet, yes, it helped me feel better, but I thought, when I'm going to die of heart disease, or I'm going to gain a lot of weight. And so that's when I started. I want to make sure I say this, because this is about mental health. My mood and my energy and my concentration got a lot better. I mean, I'd never really been aware that they were a major issue to begin with, but I couldn't believe how much better my brain worked on this diet. And that really got my attention, because that went beyond me. Like, with this, why is this diet so good for my brain? I never thought about food in the brain before. I mean, in 4 years of residency, we didn't talk about nutrition once. And so I just started studying nutrition very passionately, reading articles, hundreds of articles, trying to get to the bottom of these things. And what I discovered was, I'm sure you've had a similar experience, just about everything I thought I knew about nutrition was completely wrong.
Yeah.
And that's what happened.
It's an amazing story, and just as we are starting our conversations, I hear all these lessons, and the first lesson is that you can depend on a lot of different medicines to treat a lot of different medical conditions, or you can just do a lifestyle change that may fix everything. I think that's an insightful comment. The second is that the best experiment is the N of one.
Yes.
Right? So for those who are listening, N's represent how many people are in the study. Well, in this case, it was just one. And the best way to know what's best for you is to do your own experiment. And that led you to the things that didn't harm your body, as opposed to things that were helping. And then I am particularly, agreeing with you about this mood, energy, and concentration. And the lesson there is, sometimes you don't even know when you don't have good mood, energy, or concentration, because you've never felt good mood, energy, or concentration. So when you finally get it, you're like, oh my God. Oh, I didn't know I was tired, and I didn't know I didn't have mental clarity. I didn't know I was a little, difficult to be around. Right. So I love that. So I just think, as we kind of walk through our conversation, it's important that we want to take these little nuggets and really walk away with as much information as possible. And I guess that'll lead to my second question. We both train to consider lifestyle modifications whenever we are helping patients with chronic conditions. I mean, we're taught, lifestyle first. However, a lot of times that then leads to, well, what's the best medicine? So we'll say lifestyle first, but then we are in action. What we do is we give medicines, we do procedures, we do surgeries. So the quote, "Let food be thy medicine and medicine be thy food," harkens back to Hippocrates, the father of medicine. This quote, through thousands of years, because it's an old quote, acknowledges the importance of healthy eating and how the nutrients in our foods can actually heal us. So, my question to you, what happened? I thought this was foundational in how we should treat our patients. And it seems like our conventional training has totally forgotten about this message.
Yeah. Well, you may have trained later than I did. I mean, I trained in the '90s. I went to medical school in the '90s, and I don't remember there being a lifestyle first philosophy. I do remember learning a lot about medications and how medications work and procedures. And we had in 4 years of medical school, we had about maybe 2 hours of nutrition education in 4 years. And as I was saying before, in 4 years of psychiatry residency, we didn't talk about nutrition once. Even when we were talking about people with eating disorders, we didn't talk about food. And so, I kind of came out of my residency program thinking about the brain as a bag of neurotransmitters
Mm-hmm.
designed to be manipulated with medicines. I didn't know anything about how food affected the brain. And uh, one of the things I love about how I work now is I find that the connection so powerful and empowering for people and really fascinating.
I like it. And I I think our training may have been similar in that the mention of lifestyle is first. It's a mention. Now let's just think about the conferences uh, we both had an opportunity to attend, and they, most of the presenters would say lifestyle is important. And then they'd spend like the 98% of the rest of the conference, or the talk talking about, the medication. So what I'm finding is that they will say that, but what happens is they never teach you how to do the lifestyle, and they don't spend any time talking about it. So I think there's a part of them that understands it's important, and some of it is they don't believe that the patients will do it. They don't have faith in the patients, and I think we've both learned in our practice is that patients will do it if you give them information that actually works, and you coach them and guide them through their journey. They need your support. They need the right information. And when they struggle, we don't demonize them. We say, hey, struggle is normal. So I just think that we just weren't taught. And I think for both of us, we probably learned this stuff on our own. And I just don't want to live in a world where doctors have to learn this on their own. That's just not the way healthcare should be. So I think I understand why your perception is that it wasn't there, because it's not emphasized at all. It's just horrible. So wow, it just blows my mind. So but I could imagine also when people show up at your office, and they do this with me too. They show up at my office. Maybe they don't know me. They hadn't heard of me. And we spend a lot of the visit talking about lifestyle stuff, right? But I'm not a doctor of the brain, although I do feel like a therapist many times in my visits. So I can only imagine what their reaction is to you when they come see a person of the brain, a doctor of the brain, and then you start talking about lifestyle. So what's that experience been like when patients first hear you start talking about carb restriction and things like that?
Yeah, well, right now my practice is 100% nutritional psychiatry, and the people who come to me are already interested in nutrition. But for many years, I practiced in really kind of more normal settings, mixed settings, where I was able to thankfully incorporate nutrition into my work if I wanted to. But the reason I was hired, the main reason I was hired by different, hospitals or clinics or universities, was to prescribe medication and manage medication. So it took a lot of practice to be able to try to incorporate nutrition into those conversations, because I'd never been trained to do that. And yeah, you definitely, I mean, people are not used to hearing, especially people coming to a psychiatrist, they're not used to hearing about, about food and diet. So they might be used to my talking about their feelings or their childhood, their family. I can ask all kinds of super personal questions. They're really accustomed to that. They're not accustomed to me talking about food. And so that took some practice, and I made a lot of mistakes along the way in the beginning. And so one of the things I learned was not everybody wants to talk about food, and it can be a really personal topic for a lot of people, and it can be, kind of like religion or politics. It can be that charged for some people. But one of the things I learned was just to bring it up in the course of the conversation, just like I would any other intervention. Just a matter of fact, we could do this, we could do this, we could do this, and include, nutrition and lifestyle strategies. But one of the things I love to do now, what I do is I ask people right from the beginning, what kinds of things are you willing to consider to help yourself feel better? And that way I get to hear, it sort of sets the stage for them to feel as though they're going to be taking an active role in their recovery rather than just receiving a medication passively. It gets them thinking about, like, what would they be willing to do? And so that kind of helps me understand whether it's okay to talk about things other than medicine, and kind of get their permission, to talk about things other than medicine. And I like to, ask things, like if there were strategies other than medicines that could help you get to the root of the problem, would you be open to hearing about those and thinking about those? And, or asking something like, did you know that things like inflammation and high blood sugar or high insulin levels can actually kind of set the stage for mental health problems? There's a lot of new research about this. Have you heard about that? Would you be interested in hearing more about that? We could run a few simple blood tests to see if we can discover any potentially reversible causes of your symptoms, and kind of get curious together about what they show. And then if we notice any abnormal results, instead of me saying to them, "Oh, you have such this lab test is really abnormal, and that means you have this new diagnosis, and that means you have to take this new medicine for the rest of your life." Instead of that, I can say something like, "These results give me hope, because there's a lot we can do to improve these numbers without medicines. And if there's something wrong on these lab tests, it might have a lot to do with why you're depressed or anxious." And so people really coming to a psychiatrist they're used to talking about feelings, but they're not used to talking about data. But people really are curious about their results, and they want to see. And it's hard. It gives us something to look at together, so that we can be on the same side looking at the same problem together.
I like this as well because, first of all, how a patient perceives that conversation, and like you said, being more collaborative, it matters that they're collaborative. Words matter, how you say things, how you approach things. And for all the clinicians listening, this is a valuable lesson. In fact, let's take it broader. Leaders listening, wives and husbands listening. If we could, okay, let's state the problem. Let's what do we want to change? Maybe how do you think you would change it? And then, of course, let's get started. And that basic approach, and when you get to the part about how, a lot of times they don't know how, and that's when we give advice. But it'd be interesting to hear what they have to say. I just think empowering people to help us help them this way is very effective, as opposed to just, I'm the authority. I'm one of the few people on the planet who understand nutrition and psychiatry. Listen to me. Do what I say. It's on keto or the highway. We don't want to be that kind of clinician. We want to be somebody that listens, hears, understands. And if you, because it really may tweak how you do things based on what you've heard. But if you don't listen and you haven't allowed them to speak, I think that's wonderful. So it's, your approach resonates with me, and it makes sense, I hope, to those who are listening. So, but another thing that people are probably curious about is when people come see somebody that has this different approach. I'm sure you have challenging cases because people struggle and then they find different paths and they may find their way to you. I'm just curious, when people see you and you have this approach that probably does a little bit of medication and lifestyle, how often or what conditions are you seeing people get off medicines? Because I think people, not that that's the goal. The goal is just to be metabolically healthy, mentally stable. But how often do you see people getting off medicines with this approach, this lifestyle approach?
Yeah, so I see lots of different types of conditions, from minor to major. Things from simple like ADHD and mild depression or anxiety, all the way to people with psychotic illnesses, bipolar mood patterns, severe depression with suicidal thinking, and everything in between. And some people come to me taking medication and are trying to use less. Some people come to me not taking medication and trying to avoid needing medication. And some people come to me on medication, terrified to stop their medication because the medication's been really helpful, perhaps help them avoid a hospitalization or, save their life. And so they don't want to stop their medicine. They just want to feel better on their medication. So people come with a lot of different types of goals. And I would say, and this is really the key, I can honestly say among those who stick with the dietary recommendations, and I make different types of dietary recommendations based on the person and their goals and their health status. It's not always keto, sometimes it's something else, but among those who stick with the plan, and that's the hard part, almost everybody improves to some extent, and many people are able to reduce medication. Lots of people are able to, who come to me with no medication on board in the beginning, are able to feel better without ever needing to start a medication, sometimes resolving all of their symptoms without any medicine. And some people who come to me on a lot of medication are able to significantly reduce either the number of medicines or the dosages of the medicines they're taking. And then I would say a small percent, maybe 10, 20%, are able to come completely off of their medicine. And the reason why I emphasize that is because staying with some of these diets is really challenging. So sometimes people will, especially with something like a ketogenic diet, which I'm sure we'll talk a little bit more about, it can be really hard. It's not that hard actually to get on the diet because it's kind of new and interesting when you're first starting it, and people love a challenge, and it's exciting. It's staying with the diet that's really tough. So in order to come off all of your medicines, if you're trying to treat a serious mental health condition, you've got to really stick to that diet because coming off the medicines can take a long time. You have to taper them down very slowly over a long period of time. So I hope that answers your question.
It does. And I'm not surprised, although, for me, low carb is easy because I love steaks and I'm not in love with vegetables. I'll probably be a carnivore soon. I told my wife, just let it go. We'll probably be carnivores. but but I heard someone, I can't remember who it was, but he said that like, being able to accomplish things rather, this dietary change, it's like 80% like mental and maybe 20% knowledge. So I think in the behavioral things and all the things that I still go to family gatherings where you have what would be perceived as a temptation, although we tend to bring things that would replace that, so we don't have to necessarily be like limited to that. But yeah, it's a struggle, and I think any big change is a struggle. But it definitely answers my question. And you did bring up keto a little bit, so let's just go ahead and talk about that a little bit. And I'll I'm in in a master's program for nutrition and functional medicine. You've obviously done a lot of research and reading, and so we know a lot about, maybe biochemistry. But I do want to make sure, I remember that game show, Smarter Than a Fifth Grader, right? So I want to make sure that, the major, everybody, no matter what their training is, they can get it. So let's just talk a little bit about, just a basic understanding of why the keto diet works and why it's just good for our brains.
Okay, so my favorite question in the world. so, uh, a keto diet, basically, what it does, if anybody out there isn't familiar with it, is that it lowers your blood sugar levels and your insulin levels enough to turn fat burning on in the body. So you start burning fat as your primary source of energy. And when you burn fat for energy, you create ketones that can feed the brain. And the brain can run entirely on sugar, glucose, that's floating around your bloodstream. It can run 100% on glucose, but it prefers to run on a mixture of glucose and ketones. And the reason why, and this has been shown in scientific studies, that most brain cells will choose ketones over glucose if they're given a choice. And the reason is that ketones burn more cleanly and more efficiently and with a lot less collateral damage than glucose does. So it's a healthier fuel for the brain. I mean, the brain can't run entirely on ketones. There are parts of the brain that can't use ketones, but your brain will be healthier and it will be protected from. There'll be a lot less damage and a lot of a cleaner, sort of more steady, reliable source of fuel for the brain. So it's a really excellent fuel source for the brain. But one of the ways that it can really help the brain is by reducing inflammation. And so if you eat too much sugar, if your sugar is going too high too often in your blood, so let's say you have a glass of orange juice in the morning, your blood sugar is going to go too high, most likely. And if you pour too much sugar, like liquids, crystals, powders, all those kinds of concentrated refined carbohydrates into your body, then you're going to get a big blood sugar spike. And every time your blood sugar spikes, your brain sugar spikes. And that's very dangerous because the brain is really vulnerable to damage from sugar spikes. And every time you get a sugar spike, you're getting a lot of inflammation that goes along with that. And inflammation is really damaging. And the high sugar spike in the brain, if there's too much sugar floating around in the brain, it'll actually make protein sticky. So all those special little sophisticated components of your cells, all the little parts of your cells that need to be running smoothly, you can actually start to get molecules that stick to each other and kind of get crippled and crumpled up into these dysfunctional, twisted things called advanced glycation end products, or AGEs. And they create, the brain mounts an inflammatory response to try to get rid of these things that are piling up in the brain, these crumpled up molecules that are all sticky with sugar. So it's just a mess. And it's one thing to have inflammation every once in a while. My brain can handle that. It can call in the troops and heal it up. But if you're eating high sugar foods 3, 4, 5, 6 times a day, which is what a lot of people are doing, and it's what a lot of children are doing, then the inflammation isn't every once in a while. It's chronic. It's all day long and into the night, and the brain never gets a chance to recover. So and that's very, very damaging. So inflammation comes down on a ketogenic diet. Energy goes up. Brain energy goes up on a ketogenic diet. And the other thing the ketogenic diet does, which is really cool, is it boosts the brain's own antioxidant levels. So we can fight oxidative stress without blueberries because we have our own antioxidants inside of our brain cells just waiting to be used. And the ketogenic diet allows us to make more of them. So there are lots and lots of other different ways the ketogenic diet works, but those are the the big three, right? They help with energy, they help with inflammation, and they help with oxidative stress.
Nice. And we still have blueberries in our refrigerator, but if we become carnivore, we may not, right? Now, we have to clarify one more thing. The first thing I want to say before I ask for that clarity, for those who are listening, beta oxidation, that's the only thing I'm going to get, technical with in terms of biochemistry. When you take fat and use beta oxidation to turn into energy, you can get way more fuel, ATP, than you would with glucose. That's the first thing I want to mention. I actually talked about that at Low Carb USA when I did a mitochondrial discussion that
Ooh.
we recently had. I had to get a little deep for a minute. My wife said, ease up a little bit, and I eased up. But I just wanted to mention that that's a huge source of fuel that is being underutilized, and most of it's sitting right there on our bellies. So the other thing I want to clarify, you said the brain says I'm good with ketones, I'm good with glucose. But let's just talk about a carnivore, right? So a carnivore is not eating the blueberries, and they're pretty much, so just clarify where does that glucose come from if they're not really consuming it, so that so the listeners will understand a little bit about why a carnivore can still have some glucose in their body, but they didn't actually have to consume it.
Yeah, of course. Great question. So, the brain does need some glucose at all times, small amount of glucose at all times, because uh, there are some cells which are rapid fire cells that need fast energy. And the one advantage that glucose has over ketones is that it doesn't burn as cleanly or efficiently, but it does burn faster. And so there are certain cells that need rapid energy, and then there are certain pathways in cells that cannot use ketones, and they're the construction pathways, the polyol pathway. So anyway, where does that glucose that we need for 20 to 30% of the brain come from? Uh, we can make all the glucose we need ourselves from inside our own bodies out of protein and fat from the process called gluconeogenesis, which just means making glucose from scratch. We can do that all day, all night long, smoothly, reliably, no peaks and valleys, no drama,
Mm.
completely on our own. So we do need glucose, but it doesn't have to come from outside the body. And in fact, it's probably better if it doesn't come from outside of the body, because when you get it from outside the body, you can get a lot of instability in your glucose and insulin levels.
Yes, thank you. It sounds like music to my ears. That's why, it's funny. Biochemistry kicked my butt in medical school. Now it's like my favorite subject, right? So it's really good to know some biochemistry. But I just wanted to make sure my listeners, because it can be a little confusing, and they're like, well, where's that sugar coming from? But another important message is the peaks and valleys, right? So, your body is very smart, and if you just give it the right nutrients, it'll release the glucose on demand when you need it, when you're metabolically healthy. So I just want to emphasize that. And I think we both are aware that only about 12% of Americans are metabolically healthy.
Right.
So it's just a very small percent, and we want to, honor that by giving our body the right tools to get to that goal. So another message that is out there, is popularized, and I'm learning this even in my nutrition studies. And, I'm always pushing back with my professors, and this idea that plants are better than meat.
Mm.
Plants are better for everything, better for the environment, better for our bodies. But I just want to provide some clarity around that topic. And we'll probably need to go all the way to the vegan diet, since that's a little bit more restrictive. And so when it comes to a vegan diet, you have patients, I'm sure, that you see that may have entered your office on a vegan dietary plan. But because you know what you know that there may be some issues around that. So let's talk a little bit about the types of nutrients that they may become deficient in, and how do you deal with that when you're faced with a patient with that issue?
Yeah, so I have a lot of experience talking to people who choose vegan diets, especially since I worked in college and university settings for so many years,
Hmm.
and especially at Smith College, where vegan diets are very, very popular. So, and I like to say, and this is absolutely true, like I'm nutritionally pro-choice. So I don't I don't try to convince people, to eat a different way than they feel comfortable. I just want to help them optimize their diet of choice for their brain. And I give them the information, I let them know that, ideally, the best way to get all the nutrients you need with the least amount of drama and damage and risk is to include animal foods in the diet, especially meat, seafood, or poultry. I do say that, but I will help people optimize whatever diet they choose to eat. And so, if someone is choosing to eat a vegan diet, uh, absolutely, we need to do some nutrient testing to see if there are any deficiencies that we need to correct. It's really important for anybody who's eating a vegan diet to take a vitamin B12 supplement. It's really important to take an omega-3 fatty acid supplement from algae, not from flaxseed or any other type of plant food. It has to be from algae because plant foods do not contain any EPA or DHA, and DHA is critical for brain function, and EPA is critical for your immune system to function properly. So, and you can't get those from plants. So, very important. And also, just like all of us should do, removing as much processed food as possible from your diet. So, because a lot of people who are eating quote unquote plant-based diets, they forget about the whole food part. So, whole plant-based diets that are junky have never been shown to be healthier than any other kind of diet. It's the whole food plant-based diets that have shown to be, in some studies, a little bit better. And so, if you're not doing the whole foods part, you're going to be in a lot of trouble. So I definitely I test people for B12, which sometimes means going beyond a simple B12 level. I test people for ferritin, which is a nice sensitive marker for iron deficiency, and B vitamins, which can be a little bit more complicated, challenging to get from vegan diet, and other types of things depending on the person's history. But we really work to optimize the nutritional quality of the diet by getting out the processed foods, supplementing properly, and testing to make sure we're not missing anything.
And that idea that when you compare a standard American diet to a vegan diet or a vegetarian diet or a Mediterranean diet or a DASH diet or a low carb diet or a keto or a carnivore, pretty much the standard American diet has no chance. It'll always lose. So the first goal is to let's eat real food and see how we do. And I think the other message here is metabolic health. So if you're doing a vegan diet or a vegetarian diet, you need to have the awareness, work with a clinician that understands what can be deficient, what needs to be tested. And if you do a very, monitored diet, you'll probably be able to do it. It's just a little bit harder. So I think that, but the bigger message for me is we have to honor the fact that meat, protein is more of a complete nutrient source. You don't really have to supplement your way through that type of dietary approach. And that's really important for people to hear. And how you interpret that in terms of the proper human diet, as Kim Berry would say, that's up for you to do. But the key is to understand that when you eat certain ways, you have to understand where the deficiencies may come from. And it does, speaking of Ken Berry, who's more of a carnivore, I know his wife is kind of moving in that direction. Let's talk a little bit about that, because I had a couple of guests on the podcast. The brilliant Amber O'Hearn was on and you got to love her, right? She's so smart. I learn a lot just listening to her and hearing her comment on Twitter and just how she interacts, and she's well read and she does her job, and how a carnivore diet was able to treat her bipolar. And then I had Matt James. He has a completely different approach. He uses diet. He finds out what kind of brain type you have. He, is it more sympathetic, more autonomic nervous system, and then he uses diet to treat that. I think he's he's over the border, maybe in the UK. So So my question is, obviously, carnivore is a version of a carb-restricted diet, but when should the listeners consider that type of dietary approach?
Yeah, so I use carnivore diets in my practice quite a bit, and I use them in several different types of situations. So I obviously will use them if the person is interested, if that's why they're coming to me. Some people are coming to me for help implementing a carnivore diet, and so that's certainly something that the option is open to just about everybody if they want to try it. But the I use it a lot when I use it a lot as a how do I say this? I use it a lot in the very beginning as almost a transitional diet when people are first getting onto a ketogenic diet and they're feeling really confused or overwhelmed by trying to count carbs or figure out how many vegetables they can have and what exactly they're supposed to eat. If people are kind of feeling overwhelmed by that, I just say, well, why don't we just keep it simple, just to get you into ketosis? Just eat as much meat as you want, meat,
Mm,
seafood, or poultry for the next week or two. You'll be in ketosis within a few days,
right.
and then we can expand beyond that if you like, just to keep it super simple. And so I use it a lot as an initiation strategy, but I also use it very frequently as sort of almost in a way, sort of as one of the best elimination diet strategies available. It's a lot of people think of detox diets as things with like juice cleanses and things like that. Detoxing the body from lots of different things. But I actually think of the carnivore diet as one of the best detox or elimination strategies out there, and that's because it removes all of the plant foods. And plant foods are really complicated.
Mm,
And they have fiber, which is difficult to digest. They have lots of defensive compounds, which can, irritate our guts and provoke our immune systems. They have lots of anti nutrients, which interfere with our ability to absorb nutrients from food. So, they're very complicated. And they, of course, have carbohydrates, which lots of people are unfortunately not able to tolerate anymore. So they're really a great go-to for people who are struggling. Let's say you've gone onto a kind of a standard keto diet and you're not feeling better enough, or or you have a lot of autoimmune issues or unexplained symptoms like chronic pain or fatigue. It can be, rather than kind of eliminating one thing at a time, doing a really simple kind of clean carnivore diet can be a wonderful place to start. And then you can either stay there if you want, or you can expand from there. But it saves a lot of time and frustration to do that first.
I know that the steak that I love, which is ribeye, does not have anti-nutrients because whenever I eat it, I feel wonderful. And then if
Mhm.
I try the Brussels sprouts and some other vegetables, my stomach's aching or I'm having gas. So who'd have thought that the plants we've been asked to eat all these years could have something in them that would actually protect the plants from us. And some of us feel fine when we eat them. Some of us feel a little gassy, and others get sick. And who'd have thought? So it's just nice to know that I can eat my protein and my other animal sources and not worry about anti nutrients. But it's just a weird way of thinking, having, I just learned this stuff in my training. I did not learn this in medical school. The term anti-nutrient didn't exist. Phytates, oxalates, I didn't know any of this stuff. So it's really nice to have a platform to talk about these things. It's been wonderful. So let's talk about fat.
Sure.
Um, our babies eat a lot of fatty foods. And it's been told that the brain needs fat and it's a good thing. So I want to talk a little bit about why our brains need fat.
Yeah. So the brain, about two. If you wring all the water out of a brain, the rest, if you just look at it dry, about 2/3 of it is fat, and that's on purpose. And anybody who's been to medical school or done any kind of medical training, if you ever held a brain in your hands, it's quite slippery. It's very, very fatty. And so there are lots of specialized fats in the brain that let's think about one in particular. Probably the most important fat in the brain is called DHA. It's a really special omega-3 fatty acid, and it's been it's been highly conserved through evolution, which means that this molecule has remained unchanged for many hundreds of thousands of years because it does this very special thing, which is it buffers electricity. So it has these special quantum mechanical properties, and it buffers so anywhere in the brain where electricity is being used, you'll see the DHA molecule is sitting there buffering that electricity. So it's really important, for cell to cell communication. Passing neurotransmitters back and forth like serotonin and dopamine. It's very important. It's important for the development of the brain, the proper development of the brain. It's really important. It's DHA is embedded in all the little mitochondrial membranes where energy is being generated, and the brain needs a lot of energy, much more than its weight would suggest, because it's an electrical organ and it has to be working 24/7. So DHA is really important. That's a fat, and that's a fat that is best obtained from animal fats. You can't obtain it from plant fats. You can get it from algae because algae is neither a plant nor an animal. It's kind of in between. So without DHA, a lot of experts in lipid science who study the brain and lipids say, and fats basically say that without DHA, human intelligence would be impossible. It's a really special molecule. So that's just one example of how important fats can be to the brain. And then fat in general, and cholesterol, to insulate all those electrical circuits in the brain, you need fat and cholesterol to do that. So in any case, they're super important, and the brain can't absorb fatty acids. They can't cross the blood-brain barrier. So ketones, when you're burning fat, when you're eating a ketogenic diet, or if you're not eating if you're doing some intermittent fasting and you're turning on your fat burning, when you're burning fat, ketones are being produced, and those ketones cross into the brain where they are used to create the fats that make up the brain. So it's very important for all brains, whether you have a mental health problem or not, to spend some time in ketosis on a regular basis, even if you're not eating a ketogenic diet.
And I do remember that the brain was, maybe 20% of the body's energy expenditure, which is a ton. And it makes sense because it's probably working, not probably, it's working while you're sleeping. So it's always working. And I also remember that the mitochondria in the brain are more efficient. So they're just very efficient at making sure they do a good job in terms of, creating that energy. So it's really a fascinating organ, and God knows we need that to work well.
Yes.
Please. But you do have fat in red meat. So, but we live in a world where red meat has been demonized, and I love my my red steaks. So let's talk a little bit about why we're so afraid of red meat in the first place when we shouldn't be.
Well, I wish I knew. Maybe it's because some sources of red meat come with claws and fangs, and they growl at you. I don't know, but
Yeah.
there's a long history of vilifying red meat, and some of that has to do with religious beliefs. Some of it has to do just with us being sentient beings, where we feel bad for other creatures, which other creatures don't typically. And also, I think there's a little bit of wishful thinking that goes into it too.
Mm.
Because wouldn't it be nice if we didn't require other animals to die for us to live? That would be
Mm.
wonderful. It's not true, but it would be great. And so I think there's a lot going on there. And then I think there are, of course, a lot of prestigious and influential organizations and researchers who have staked their professional careers and reputations on the wrong information, and they're afraid to uh, change what they're saying to people because it would mean that they'd have to say that they were wrong. So there's a lot, and there's just a lot of complicated pieces to that puzzle. And we can throw in, processed food manufacturers who are making a ton of money off of foods that aren't whole. Um, if you're not eating meat, what are you eating? You're eating a lot of grain. You're eating a lot of flour. You're eating a lot of packaged foods, often, which I hope you're not. But there are a lot of different players, and I think that the most important thing, it doesn't make any sense. It makes absolutely no sense that a food that we've been eating for hundreds of thousands of years would be suddenly causing this huge spike in health problems that we've seen only in the past century or so.
Right. And we're recording this on September 29th, and on that day, I saw that you saw a tweet I put out there, which was, the limit on saturated fats is unnecessary, says state of the art review in the Journal of the American College of Cardiology. But then it said the JACC abstract reads the recommendation to limit dietary saturated fatty acids intake has persisted despite mounting evidence to the contrary. This is dated June 24th of 2020. Didn't seem to make headline news. It wasn't breaking news. It should have been. And that's what we're up against for those who are listening. Even when the science supports what we're talking about. And the good news about what we're talking about today is that it's all evidence-based. It's all biochemistry, all the way down to the basics. And it's, it's hard to misinterpret that, even though you can. But it's important that we stick to the science as much as possible. And speaking of science, there's, we have issues with one of the reasons why we have confusion is because of how we look at studies and how we interpret studies. So, so what's wrong with nutritional science when it depends on epidemiological studies to make decisions about what we should be doing clinically?
Oh, heavy sigh. So, nutrition epidemiology is it's not only not scientific, it's anti-scientific. And I say that so most nutrition studies that make their way into headlines and dietary guidelines, most of the constantly changing headlines. Well, one day eggs are bad for you, the next day they're good for you. This now you're supposed to eat this many cups of blueberries or this many, this many. I don't know, stalks of broccoli or whatever it is. All those strange, confusing, constantly changing, overwhelming, ridiculous headlines come from this field of nutrition, this way of studying nutrition called nutrition epidemiology, and all it is, these are not scientific experiments. These are just questionnaires, food questionnaires. You ask a bunch of people, what, over the past year, how many, cups of blueberries did you eat per day? And that sort of ridiculousness. And people are expected to remember or guess, how many cups of this or that they've eaten over the past year. And they're usually not given the option of saying they don't know or they don't remember. You're usually forced to choose a quantity. And that's the data. Those wild guesses become the quote data that these headlines are based on. And so, these so they generate a hypothesis like, oh, maybe people who eat more blueberries have, less dementia. And so they're basically taking a wild guess based on a wild guess. And then they don't test the guess. And so and then this gets published as nutrition advice. And so this is insane. And when people go and they try to test these wild guesses in a clinical study where they actually do an experiment to see whether or not these guesses are correct, they're wrong 80% of the time, which means you'd be better off flipping a coin to guess what foods were healthy than by going by a nutrition epidemiology study. So these are just wild guesses based on seriously flawed food questionnaires. And so there's no science there whatsoever. In fact, they're often leading you in exactly the wrong direction. So it's really important for everybody who gives nutrition advice to patients and every person out there who cares about their health to understand the difference between that kind of a study and an actual piece of reliable information so that they don't get led down the wrong path. This is literally destroying people's lives because we're given all the wrong information.
It is. And again, for those who are listening, the Public Health Collaborative has graciously put all the randomized control studies together that compare low carb to low fat. And when it comes to the significant weight loss and improving these metabolic markers we care about, it was basically 36 low carb versus 0 low fat. And so basically it's really no doubt that the low carb diet was the more effective diet when it comes to randomized control studies. Now, keep in mind, Doc just said 80% of the time when you do epidemiological studies, not randomized control studies, it doesn't match what the epidemiological studies suggested. So when you're hearing a clinician or CNN or anybody else make a statement about a study, when you look that study up, most of which are available on PubMed, the first thing you have to understand, is it a epidemiological study or randomized control? The good news is you don't have to always know all the different types of epidemiological studies, prospective, retrospective. You don't have to really, if it doesn't say randomized control trial on that abstract, it probably wasn't. Because they take pride in that because they know that's the standard. So you can't then walk away from that information if it's epidemiological and make a educated decision about what to do in your life. It's because it's a guessing game at that point. Now, do we then take that information and do the right kind of studies? Absolutely. So I just think it's important that everybody listening be a little bit of a detective, because most clinicians do not make the distinction when they receive information. They just look at an abstract, they go to the results, and then they change how they practice. And we have to change that. And I hope that in the future, that's what happens. So I do want to ask you about, you mentioned dementia, and dementia definitely has impacted my family. Somebody very close to us. In fact, my wife's dad, we take care of him, and I thank him for teaching me in a way that I hadn't been taught before. I thank him for that because I have learned about dementia in a way I hadn't learned before. And so I'm able to, be a caregiver, a family member, a son-in-law. And I thank him for, he didn't know he was going to teach me, but he is. And so the question, since you're a doctor of the brain, talk a little bit about how effective this type of dietary approach, whether it's just keto, just low carb, carnivore, and who's going to benefit when it comes to dementia. I mean, how far along is too late, and just generally, just any recommendations you can make, because so many people listening have family members who are suffering from dementia.
Yeah, and I'm really sorry to hear about about your wife's dad, and there's so much wonderful, empowering, and hopeful information available about how to help prevent dementia and how to try to address it once it's started to show its face. For people with, what's called mild cognitive impairment or pre-Alzheimer's, where they're just having, minor memory lapses, even to the early stages of dementia, it's not too late to change your diet and try to improve the health of the brain. But it's, you obviously want to start as early as you possibly can, because dementia doesn't just happen in your 60s or 70s or 80s. It's happening, it starts decades before you notice any symptoms. So it's really never too early to start thinking about this. And the whole reason I started studying dementia, even though my specialty had been college mental health, was because I learned that people in their 20s had been, found to have signs of sluggish brain glucose processing. That's one of the stepping stones to dementia. And people are on the road to dementia without even realizing it. And one of the wonderful things about, Alzheimer's and nutrition is that we're usually told that there isn't anything we can do. We're usually told, oh, there aren't any medicines that work, or the ones that we have, they barely work at all. Oh, it's bad genes, or oh, it's just how old you are. We're told that the risk factors are, age and genetics and family history, and so we feel like there's nothing we can do about it. We feel completely hopeless. But the information about nutrition and brain metabolism and dementia is really strong. I mean, we've got decades of really strong research, multiple lines of high quality evidence showing not just that things like insulin resistance, kind of high insulin and glucose levels from bad lifestyle and the wrong diet choices, that insulin resistance is a really powerful risk factor for Alzheimer's disease that we can actually do something about. You can do something about it right now, and it doesn't even take very long. And so one of the things we know from that science is that insulin resistance isn't just it's not just correlated with, it's not just a coincidence, it's not just associated with Alzheimer's disease. It's actually been shown to be a prime causal factor in most cases of, garden variety Alzheimer's disease, sort of late onset Alzheimer's disease. So it's really the problem with Alzheimer's disease is you've got an energy shortage. You've got an energy crisis because the brain is not able to burn glucose very well anymore for energy. It's burnt out. And so you've got to give it ketones to bridge that energy gap. So the ketones cross into the brain and make up that slack so that it can start to bring parts of the brain back to life if they're still sort of they're kind of sputtering along and waiting for energy. And so again, the earlier you do this, the better. But even if you have mild cognitive impairment or early Alzheimer's, it's still absolutely worth your time. And I have patients who have really had some wonderful benefits by switching to a ketogenic diet, even in stages of early Alzheimer's. So it's really important to learn about that and talk to your doctor about that and see if it's something that you can do. Because once moderate or severe Alzheimer's is upon you, it just becomes really difficult to follow any kind of a lifestyle change. It's just really complicated to do at that point. So, but this is a really, really empowering message because it doesn't just change how people think about Alzheimer's. I think it changes how they feel about it. So we don't feel hopeless about it anymore, powerless,
Love it. And I'm happy to hear your comments because I did have the privilege of having Amy Berger on a previous episode. And of course, she talked about her book, The Alzheimer's Antidote. And she had a similar message that it was a energy fuel shortage issue. I also personally use Care Blazers on YouTube. It's a YouTube channel. And it's really taking care of the caregivers and teaching them how to manage things when things are, how do you respond to a family member who's saying things that are, not really reasonable, and how do you respond in a way that doesn't create more attention? So I think there are a lot of resources out there. And it sounds like what you're saying is no matter where you are on the spectrum, this is probably going to help you. And the earlier you do it, the more it'll help you. So it gives people hope and something they can do themselves instead of depending on, pills and things and lotions and potions. You want to have something you can do yourself. So thank you for that. And we will use that advice to protect our nest. And in our nest is her dad. So love that. Absolutely. And of course, that's my segue to asking you the question I ask all my guests, which is, over the next year, your plans on how you're going to protect your nest. And for those listening, it's about nutrition, exercise, less stress, more sleep, thinking in a way that's positive of, recovering from trauma, avoiding trauma. And the rope talks about making sure you have healthy relationships, avoiding organisms. In fact, I'm going to have the privilege of interviewing an infectious disease doctor for next week's episode or the week after to talk about that. Of course, avoiding pollutants and protecting our emotions and making sure our life experiences serve us. So when you think about your journey, any particular areas on that nest and rope journey that you plan to focus on?
So the big focus for me right now, since I'm about to turn, I guess I just did turn. I think I'm in denial. I just turned 57. And
Cool.
so as I've been going through my sort of perimenopausal years, it has been a big challenge for me to increase my physical fitness, increase my exercise, change the types of exercise I'm doing, and just make a real commitment to that. So in addition to the nutrition, which I feel I've really got down and has really been very helpful to me, I am trying to incorporate different types of exercise into my daily routine and make it a priority, which I used to years ago, but somehow got so busy, with traveling for conferences and speaking and writing, and then I launched this new course for clinicians, trying to teaching clinicians how to use ketogenic diets in their mental health practices, which was a huge new undertaking for me last year. And I just found myself not prioritizing my physical fitness. And it's really important to keep that going, because if you don't use your body, it does actually fall apart. And so it's really important, not just the food, but the exercise. So that's why I love the E in your nest. And also prioritizing more sleep. So again, all these different projects that I've had going, as much as I love them, and as much as they feed me, I love my work. It's important not to overwork, and important to take care of myself so that I can, be a good example for my patients and my colleagues, and also just be healthier. So sleep and exercise. I think exercise really is my main focus this year.
Nice. And I think it's important to say this. And what I want to say is maybe about 3 years ago, I had not mastered sleep. So, and then maybe about 2 years ago, I had not mastered exercise. So I am consistent now. I'll admit, I have converted to Dr. Ben Bokikio's approach. 15 minutes twice a week. We walk, we stretch. And so I've made it easier because like you, I'm busy. But I say those two things to say that if you're listening to this podcast and you're thinking, oh my God, these people have figured it out. No, we haven't. We're still trying to figure it out. We're just like you. we're trying to get to our ideal, our true north, and we're all going to be doing that until we leave this place. So it's important that you understand that if you're listening, that it's okay to, and that nest and rope, has a lot of different components, and you just say, where do I have gaps? Let me work on this. And I think that if you take that approach, you'll be successful. So I really appreciate what you're going to focus on. And of course, there may be those who want to hear more. So where can people find you if they're interested?
Yeah, so I have a website called Diagnosis Diet, and that's people can contact me through that website. They can learn about, if you have clinicians that are listening who are interested in learning how to use ketogenic diets to help people with mental health problems, because there are some special things you need to take into consideration if you're using these diets in patients, um, things to help them through the keto adaptation period. How do you adjust the medications? Who should you not use this diet in? Those sorts of things. So if they want to learn about that, they can go to my website. But I also have just lots of free articles and information on my website about food, about vegetables, about ketogenic diets, about mental health science. So lots of, and about epidemiology, if people really interested in that. I've got an article about that I tried to make funny. I try to put some humor in my articles. I also write for Psychology Today. So if you go to Psychology Today, there's a lot of articles there, including one, if you're interested in dementia, there's one called, they keep changing the title of it, but it originally was called Preventing Alzheimer's is Easier Than You Think. And it's a really, short article that gives you great advice. And it's not even about keto. It's just about how to eat to try to prevent Alzheimer's. And it's really essentially a whole foods message. And it has, good ideas there about how to get started. And so, I'm on Twitter, Georgia Eat MD, and I really am looking forward to starting very soon this season. Actually, got some wonderful advice from Dr. Berry about this. I'm excited to start a YouTube channel soon, which one of the main reasons I want to do that YouTube channel. Well, two reasons I have to say. One is because I know a lot of people don't like to read, including my own mother. And so, they'd rather watch a video or listen to a podcast. And so I think being able to reach more people with a video would be nice. And also I want to start a story share project where my own patients and other people can share their stories of how nutrition changes have improved their mental health. Because I can talk about science all day long until I'm blue in the face, but nothing inspires people like a story. And so I'm really excited about that project, and hopefully that'll be up and running in the next couple of months.
I think we all look forward to that. And I agree with you. People are busy, so we have to kind of meet people where they are. And who better than to provide some coaching than Dr. Kim Berry? So I really, in fact, what's ironic about that? Dr. Berry actually was the primary inspiration for me. He said, you can reach those 25 people or you can reach millions. So he actually inspired me too. So kudos to Dr. Kim Berry for
Indeed.
providing inspiration. I really appreciate him kind of being a pioneer in this space of carb restriction. So we want to thank you for taking the time to be with me today and my audience. And I enjoyed it. I'm looking forward to our continued partnership, collaboration, and as we kind of work towards a similar goal, which is to help people become metabolically healthy and heal both physically and mentally. So thanks again. Okay.
Thank you very much. It was really wonderful talking with you, and it's really nice to talk with your audience too.
Absolutely. So, guys, as we wrap up today, we are so thankful for our guests for having the courage to challenge conventional wisdom, not only to heal from her so-called chronic medical conditions like fibromyalgia, migraines, irritable bowel syndrome, chronic fatigue, but to just create awareness that all those suffering from mental illness may also benefit from a well-formulated carb-restricted diet. So if you felt depressed prior to hearing this episode, I hope your depression is fading away, because now, now you have the knowledge to start your journey to a life without depression. So if you have not already, now is the time to remove the fears of fat, meat, and other ways of thinking and start healing. You and your family are not destined to have a life of chronic illnesses. And when you heal, you will open up the possibilities you've dreamed of in the past, whether it's keeping up with the grandkids, taking a hike, or simply having the motivation mentally to live the life you've always wanted. So I hope my guest has inspired you as she's inspired me. And, as we wrap up, I appreciate all of you for taking time out of your busy schedule to check out this episode. And as we wrap up, I only ask you be safe, be well, and continue to protect your nest. You've been listening to Protecting Your Nest with Dr. Tony Hampton. For more, visit drtonyhampton.com.